Uh, Good morning, good afternoon, good evening, everyone. It's my pleasure, and in name of the Executive Committee of ISSM, to have you all here, all members of the ISSM. We are a big family. So we are beginning now a webinar with the State of Art lecture by Dr. Ron Lewis. And after the start of art lecture, we will have our General Assembly online. So please stay with us for the business meeting afterwards. So I would like to introduce the moderator of this webinar, Dr. Eric Shang. Dr. Eric is a urologist from Australia and holds the professoral academic appointments at the University of Queensland in Brisbane and at the Macquarie University Hospital in Sydney. He is the Secretary General for the Asia Pacific Society of Sexual Medicine, Chair for the Andrology section within the Urological Society of Australia and New Zealand, and the Chair of the Scientific Committee at the International Society of Sexual Medicine. He was the convener for the 17th biennial ISSM meeting in Brisbane last year, and serves also as the scientific convener for the 22nd World Meeting on Sexual Medicine to be held in Japan in 2021. So please, Eric, come over and introduce Dr. Ron. Thank you very much for being with us.
All right, well, thank you, Mr. President, for the wonderful introduction. Hello to everyone from Brisbane, Australia, and thank you for joining us as this very historic ISSM webinar. It is my pleasure and honor to introduce Dr. Ron Lewis, our distinguished speaker for this today. Dr. Ron Lewis is a retired urologist from the Medical College of Georgia at August University as Professor Emeritus in Surgery Urology. He has spent over 43 years as an academic urologist at 3 institutions, the other 2 being the Tulane University and the Mayo Clinic in Rochester. His main interest is in the field of andrology, including male fertility, sexual medicine, and prostate disease. He has attended since 1978 all the meetings that have what become the International Society of Sexual Medicine today, and has served in this organization in all officer positions, including the prestigious president of the ISSM from 1998 to year 2000. He is currently serving as an unofficial historian and senior consultant to the publication committee at ISSM. Let us welcome our dear friend, Dr. Ron Lewis, for his exciting presentation on the growth and history of the International Society of Sexual Medicine over the last 4 decades. Dr. Lewis, please.
Okay, can you hear me?
Yes, we hear you well.
Okay, so let's go to the first slide. Let's move along. So it's impossible to really talk about the history of the International Society of Sexual Medicine without mentioning our main function. We're an international organization open to all with scientific interest in sexual medicine, and we are a parent organization of 6 regional sexual medicine societies. The purpose is to hold periodic meetings around the world and also to hold various symposia in partnership with regional societies, as well as sponsoring guidelines and having consensus meetings with other organizations to produce publication data regarding sexual medicine. The other thing was to establish journals, and we'll get to that as we talk about the history. We also developed guidelines for sexual topics for health care workers and educational tools regarding sexual medicine for patients. Next slide. This is just a breakdown of all our regional societies, and you can see that most of them really became regional affiliates in 1997 when Bob Crane decided that the better structure for this international organization would consist of having these regional memberships. Next slide. This one also shows some of the more recent ones and some of the ones that have changed over the years. Next slide. So where did this all start? It actually started when Dr. Zourniati, who was chairman of urology at Cabrini Medical Center, decided with Dr. Giuseppe Rossi to have the first international conference on corpus cavernosum revascularization in New York City in 1978. He invited Vaclav Makal, a Prague, Czechoslovakia vascular surgeon, to present his concepts of corpus cavernosum revascularization, which he had first published in 1973. Next slide. This is Dr. Zourniati. Next slide. And Dr. Makal. Next slide. And here's one of the key participants, along with Dr. Makal, is Dr. Wagner. Next slide. In attendance were some of the people that would continue to lead this organization early in its formation: Zourniati, Wagner, Vaclav Makal, Saramon, Jean-Francois Genese, a very talented radiologist, Ronald from France, and a number of U.S. Attendees that you can read on the slide yourself. Next slide. Topics discussed were primarily on vasculogenic impotence and aging effects on penile tissue in the association of Peyronie's disease and the region of revascularization surgery for impotence. The meeting ended with a plan to meet again in 2 years to discuss further research in the field. Next slide. One of the people that I mentioned was Dr. Genese, who presented this amazing radiology of the pelvis and the penis well before some of the more modern X-ray equipment. And it was really, I would sort of have people look for this book because it's amazing the quality of radiology done by Dr. Genese. Next slide. The first international meeting was held in Monaco in the fall of 1980. The main topic were new techniques in penile revascularization, and two other areas were decided to be stressed at the meeting: nocturnal penile tumescence and penile prosthesis by Dr. Karajan and Furlow, respectively. Next slide. Here's a picture of Bill Furlow. Next slide. The second meeting of after Monaco was held in Copenhagen and hosted by Gorm Wagner, who was one of the charter members of the group. He, at that time, in a business meeting, decided that we should have a more formal organization, and thus the International Society for Impotence Research was born at that Copenhagen, Denmark meeting. It was the beginning of what we would have as our various titles over the years. Next slide. This is Dr. Wagner, who hosted that meeting in Copenhagen. Next slide. The fourth meeting, we were sort of surprised to attend the meeting and find out that the fourth meeting, we had a new title. It was the first world meeting on impotence. It was held in Paris by Dr. Virag in 1984. Again, this was published in a book form, and it was introduced by some history and philosophical discussions. Next slide. This is the book that came out of that meeting. Next slide. Papers in nocturnal penile tumescence and the early work of Rigiscan and other type measurements of penile rigidity and how to evaluate erectile impotence were presented at that meeting. Next slide. This is Dr. Karajan and Dr. Virag. Next slide. At that meeting, one of the highlights of that meeting was the discussion of the cavernosal injection of vasoactive drugs. And it was presented by Virag as well as Giles Brindley from London, who would later gain some notoriety in a famous self-injection before an audience in Las Vegas at the AUA in 1983. There were also people who had talked about injection. There were home self-injections were not yet suggested until Zourniati later suggested that in a paper. Next slide. This is Dr. Brindley, and people will remember him for that AUA self-injection presentation. Next slide. This fourth meeting, the focus, of course, was on impotence, particularly vascular, and you can see the breakdown of the different techniques. And the first, Jean-Francois Genese reward was given to Dr. Newman, and the next slide shows Dr. Newman. Next slide. At the 5th meeting, we decided that we would honor Dr. McCall, and it was held in Prague, Czechoslovakia. And you can see at the titles, it was the 5th Symposium on Corpus Cavernosa Revascularization of the 5th meeting. Injection therapy had been highlighted at the Paris and the Prague meeting. And at the Prague meeting, we heard about the new agent for injection, prostaglandin E1, from 3 different regions of the world. Next slide. Dr. McCall again. Next slide. So then we had meetings, and I wanted to show these slides to show how one of the focuses of the organization was try to rotate the meetings across the world. And I think we've done a pretty good job of doing that. And that shows you the various places that the meetings have been held, where they have been held. Next slide continues that, shows it again up till 2018. And of course, we all know that our 2020 meeting has been postponed to 2021, and hopefully we will be over the virus or have some sort of vaccine by then. Next slide. Now, here's some of the highlights of the other meetings. The first meeting in North America was hosted by Dr. Crane and Goldstein. They had invited Dr. McCall over to be a guest at their institution, and Dr. Goldstein learned revascularization surgery at that time. In 1992, we first formalized, I looked at a number of different bylaws of international organizations and put together some bylaws, and they were approved at this meeting. And it really resulted in having officers more clearly defined. At that meeting in Milan, Norm Wagner was elected president under the new bylaws, and I was elected secretary treasurer. In 1994, Robert Crane was elected president, and he was I think it's really important to give him credit for having this concept of having these regional affiliates to really make this international organization stronger. Next slide. Here's a picture of some of the people that we've just been talking about with their titles on the side. Next slide. In 1996, there was a lot of excitement about clinical trials about a new oral therapy called sildenafil. The organizers of this meeting presented to a portion of the profits from that meeting to start a new reward called the Tanago Prize. In 1998, sildenafil had already been released, and we even got questions when taxi drivers ask you, what meeting were you attending? They said, yeah, they've tried that, and they don't know if it makes it better. Of course, they didn't have erectile dysfunction, but they just were trying it anyway. In Amsterdam, I guess everybody tries drugs once. Pfizer made a $50,000 donation to the ISSM to fund prizes for recognition of young researchers, and the Dutch group had Status Plus as the organizer for this meeting, which really turned out to be good for us later on, as I'll get into the history. $75,000 from the Dutch meeting were donated to the Adrian Zourniati Research Fund. Next slide. This shows Dr. Bulletin, who hosted the meeting, and Dr. Crane. Next slide. In 2000, we had our first symposium on female sexual dysfunction, and we changed our name to the International Society for Sexual and Impotence Research. In 2002, the Montreal meeting was handled by a contract with a professional meeting organizer, and we had one of the largest profits was shared for that. At that meeting, at that time, RA Charlotte created an industrial board, and participant payments were shared with the regional affiliates, except for the European Society, which opted out. In 2004, it was the first meeting that our business office, Status Plus, ran entirely. And from then on, it was a winner for us because they became our business manager and our Congress organizer. There was much more focus on sexual medicine and women. And finally, we reached our title of the International Society for Sexual Medicine. Next slide. I put down the officers, and this just goes to show how many officers have come from different parts of the world. And again, it was Zourniati who sort of pulled me aside at the meeting in Rio many years ago, and he said, we really need a bylaws, and we need to always strive to keep this organization representative of all the areas of the world that do sexual medicine. And so a number of us have tried that over the years. Next slide. We first had a secretary treasurer together. We split that out in 2000 as the secretary general. And next slide, as treasurer. And next slide. I put this slide up only for one reason. That's to finally, in my opinion, we've come of age and we finally have a president who probably in a short hour will become our new president, but the first female president. And I think that we should all be very proud that we finally have reached that landmark. Next slide. Now let's talk about the publications. This is the first publication was started by Gorm Wagner and William Forlow in 1989 with a private publisher in London. Forlow left the editorship in 2002 and Arnold Mellman took over as a co-editor. At that time, the impact factor was 2.7. The journal was purchased from Gordon in 1995 by Stockton Press, which then became the Nature Publication Group. It remained 4 times a year publication until it was changed to 6 yearly. In 2003, the newly appointed publication committees chaired by John Pryor of London selected Erwin Goldstein as the new editor of our journal. Next slide. In December of 2003, the executive committee of the ISSIR felt it was time for self-ownership of the journal. And a group of us met in Amsterdam and interviewed 3 people and decided that Blackwell Publishing House would be the best one to have with our journal. The whole editorial staff of IJIR left that office and joined, as well as all of the affiliates. And in 2006, the International Society for the Study of Women's Sexual Health adopted JSM as its official journal. 3 issues were published in 2004, 2005 to 2007. There were 6 issues, and it became a monthly journal in 2008. The first impact factor was 4.676, which placed it pretty high. Originally a cherry red cover with a central rectangular square reminiscent of the very first cover of the ISSR journal of 1989, with the stressing of basic science and clinical research in male and female sexual function and dysfunction appeared on the cover. Next slide. Blackwell Publishing was bought by John Wiley, and for a number of years that was reflected on our spine. With the publication of volume 12, John Mulhall took over as editor-in-chief, along with Anna Maria and Andrea as deputy editors-in-chief. I can't read the impact factor because the slides of the participants are still up there, but it was over 3. And in 2018, the impact factor was 3.649. And I will update this slide as we get to the more updated impact factor. Next slide. In 2013, it was decided that we needed to split off 2 journals. So we did. The first editor-in-chief of the Sexual Medicine Review was Cully Carson, and he handled 2 volumes. The second editor-in-chief was Erwin Goldstein, with the managing editor Sue Goldstein, and they produced volume 3 through 8 up to the present time. There were 4 issues per year, and a center photograph was added to the first issue in 2016. Finally, in 2021, we're going to have an impact factor for that journal. Sexual Medicine Online editor-in-chief was Kwansong Park, who recently left that office in 2020. Alan Schindel, who spent a short time as the original editor-in-chief, became the new editor-in-chief of the Sexual Medicine. Next slide. Its impact factor is shown. The video journal was started by Steve Wilson. That was sponsored by industry, and you can see at the bottom how many hits and plays and finishes that have increased it since its initiation. Next slide. There was a news bulletin in 1998 to really keep the members a little bit more up to date on sexual medicine, businesses, and society. Luca became the new editor-in-chief in October of 2002. And issue 12 was started to be published by our business office. There was a website committee in 2000. Dr. Gregory Broderick became chairman in the fall of 2002. There will be more of this on more future slides, but I had, for the sake of time, I just put this very beginning. Next slide. Finally, and as the last slide, I would always like to particularly thank our Status Plus business office, and I decided that it really would be good as far as a historical standpoint to recognize all the different areas of service that Status Plus has been to our society and all the people that have been with us from the beginning. So this is the finish of the talk. Thank you very much for your attendance.
Well, thank you, Ron, for a very insightful presentation on the history of ISSM. And with that in mind, I would like to hand over this session to our outgoing president, Dr. Luis Otavio, for this extraordinary ISSM business meeting. Mr. President, please take over.